Welcome to the lecture series on vitamins and nutrition. So today we are going to continue with the session what we have done earlier, and today we are going to start with the aspects of food based approaches to meet the need of vitamins, and we are going to look into different aspects of bioavailability, and then we are going to look into different ways by which you can measure the quantity of food for biochemical applications, and we are also going to look into how we are going to evaluate the vitamins when it's been administered to people. So how we are going to evaluate individual vitamins and components that would be their part of the physiology. So starting with food based approaches to meet the need for vitamins, in the earlier sessions we were looking at the historic perspective of vitamins. So I have been telling about the different kinds of people and different scientists who are involved in ascertaining the necessity of vitamins in therapy. Now this is one particular case I thought I will just recollect, because in the earlier study I was just explaining, I had just given only a note on the historic perspective of who discovered it, about Professor Hopkins, and we were also talking about Professor Funk and many other people who had done key contribution. Now if you look at over here, so this is a very good classical study. This dates way back even before the vitamins could be actually utilized as a supplementary food substance. So this was even credited to be one of the first clinical trial ever to be conducted, and interesting enough, this clinical trial was conducted utilizing the need of food supplement, an essential food supplement. So if you look at this particular study, this is quite a common problem among sailors. It was the time during Renaissance when lots of adventure seekers were going around different parts of the world, rediscovering the sea routes to variety of countries, and even Magellan had taken up this task. And we find in all these stories one thing was very common. Most of the sailors, especially European sailors, who had to travel very far distance, and the ration of food whatever that they took, although at the time of loading it was very fresh, but eventually it became stale and the nutritive value of the food got diminished. So most of them suffered from this particular disease called scurvy, but there was no control study as to what could be the remedy for scurvy. So we find here British naval surgeon James Lind in the year 1747, he actually carried out official clinical trial, I would say. So what he did was he took 12 sailors, he just divided them into 6 groups, 2 in a batch, and each of the batch were administered one category of medicine to treat scurvy. Interesting enough, the food supplement which was rich in vitamin C, at that particular time of history they were not aware of vitamin C, but they knew that oranges and lemons really helped in the cure of scurvy, and to the surprise of everyone, these 2 sailors who were treated with oranges and lemons really came out well. Now this marks the official documented history of food supplements or food based approach to treat diseases. And if you look at what was that particular ingredient, and the ingredients were happened to be vitamins. So this gives a grand start in understanding how food supplements are naturally fortified with essential vitamins. Now starting from that, if you look into the bioavailability concept, which I have already dealt in the earlier session, and I have elaborately spoken about what exactly is bioavailability and how bioavailability of vitamins could play a crucial role in making the vitamins available for systemic circulation. So we see over here the bioavailability is dependent also on the food content and the amount of food which actually gets into the system. So there are different aspects, different factors that govern bioavailability. You say the efficiency of digestion, which we have already seen at different parts of the alimentary canal. Then if you look into the other aspects, for example, what are the concomitant foods, what you say as the food interaction with other substances. Maybe it could be food, as you see over here, consumed at the same time. As I've told you, this could be a beneficial interaction or it could be an hazardous interaction. I mean, to be specific, not exactly hazardous, it could be an interaction that can really diminish the amount of vitamins available for systemic circulation. So, you look over here, other substances, for example, the method of preparation of the food also contributes in the bioavailability of the food. How easily the vitamin could be made available, and if you could have a more increased surface area as a physical means, or it could be any other additive which could enhance probably an hydrophilic coating or hydrophilic attachment of the components, could also help in the effective absorption of food material. Now, if you look at the nutrients, it could be of all sorts, it could be synthetic, it could be fortified, or it could be natural. So, what do you mean by fortified? Fortified is you take a food which has its own limitation as far as the nutritive value is concerned. After a detailed scientific study, people are interested in filling them up with the required nutrients so that they would be able to make the food more appreciable in terms of the nutritive value. So, that is what you mean by fortification. So, you see over there this aspect, the second aspect what we are looking over here, have also been dealt earlier as the precursor hormones which have been converted into the active hormones. And apart from that, if you look at all these aspects, the way by which the food is being processed plays a tremendous role in the preparation of, in the delivery of the vital nutrients present in the food. So, now looking at this aspect, I have already dealt this aspect of it, where we say the solubility of the food material plays an essential role, a key role in the delivery of the substance, as fat soluble material is more available in a fat soluble environment, thereby enhancing the bioavailability of the food. So, similarly, if water soluble substances are taken over there, although the bioavailability appears to be quite quick, but you also have the other kind of problem. So, in case with fat soluble substances, they have to be essentially I would say past the barriers, and the barrier actually can be a rate limiting step, but once it goes inside our systemic circulation, the fat soluble vitamins have this advantage of being stored in your system. Whereas if you consider water soluble vitamins, although the bioavailability is quite quick, you do have an issue of storage, since most of the water soluble substances, water soluble vitamins as we are talking about them, are not stored, and therefore the bioavailability in terms is like, although readily available, but since there is a lack of storage, most of the substances are excreted within a short period of time. That actually keeps us in a position where we have to regularly replenish our foods with water soluble vitamins. Now, we are going to look at this classification. I will keep visiting this slide again and again as we are going to look into the classification in detail in the coming sessions. We will actually go in detail on every one of these components so that we would cover a wide variety of features concerning each of the vitamin. So, we are going to look at the aspect of measurement and the aspect of analytical methods involved in measuring the vitamins. So, if you could recollect, in the previous session I had explained about the daily requirement of vitamins, how we exactly quantify the vitamins, because without quantification we would not be able to really understand how much quantity of substance is associated with the required physiological response or the required biochemical response. So, generally it's a convention that we mention the quantity of vitamins either in the form of milligrams or in the form of micrograms or in the form of international units. Now, if you say milligrams, you know very well the normal convention of milligram is basically 1 milligram is 1,000th of a gram, or 1 microgram is basically 1,000th of a milligram. But if you look at international units, this will be little different and it's subject to variation depending on the nutrient. So what is this international unit? Now there is this convention of associating international units with milligrams. So when you say international units, we are talking in terms of the bioactivity of the ingredient, bioactivity of the vitamin. Generally, if you look at international units, we prefer to use for vitamin A, vitamin E or vitamin D depending on the source, because if you consider vitamin A, the source could be from vegetable source, the source could be from variety of substances. So when you consider bioactivity, so what is bioactivity? So bioactivity is you look into the actual physiological function of a particular vitamin and you quantify the biological function associated with a given concentration of the substance being used. I can give you an example. Say for example, if you are purifying enzyme from a bacterial source, purifying a vitamin from a bacterial source. So depending on the quantity of actively metabolizing bacteria which is responsible in producing that particular vitamin, let's say we are looking at vitamin B12. So batch to batch variations could be there. There could be a batch where it would be enriched with microorganisms providing a very good concentration of bioactivity, whereas the other batch when you are making could have a less bioactive substances. But when you are going to administer them, the batch which had a less bioactivity, you compensate by adding more of the extracts, whereas the one which had really good bioactivity, you reduce the concentration of the extract. So international units basically depends in utilizing the supplement based on the bioactivity of the individual vitamin. So if you look at here, there are some conventions being given, and each manufacturer, when they provide the supplement of vitamins, they mention the kind of conversion that's been used in providing the amount of vitamin required to be incorporated in a product. Now we have the analysis of compositional data sources of vitamins in food. So this has been actually a data available that gives you the quantity of food material available in different variety of food, because if you consider each food is active in its own ingredient. In other words, you could say every food has its own speciality of vitamins in them. So if you look here, you have wheat flour, you have the brown rice, raw rice, then you have a whole range of food substances, and in each of them if you look into the concentration of vitamins, so here we have a range. So you can look at this table. So you have in the first row thiamine, riboflavin, niacin, tryptophan, and you have vitamin B6, pyridoxine, pantothenic acid, biotin, folic acid, vitamin D12, B12 and vitamin C. See, if you look here, the concentration of biotin is mentioned in microgram, whereas if you look at the concentration of niacin, it's mentioned in milligrams. And the quantity, if you consider the variety of food, see, we start from the wheat flour where you have a wholemeal, then you have the brown rice which is raw. As you see over here, the concentration of individual ingredients keep changing in each of the food. See, if you go down, you find milk, you find eggs, you find beef, lean beef, you have lamb, you have pork, you have chicken. In all these food sources, you have this natural concentration of per gram weight, how much amount of these vitamins are present. So that's what we need to understand, because when we started with this, we were interested in looking at the food based approaches to meet the need of vitamins. So if we are going to prepare a diet chart, if you are going to prepare I would say a dietary placed clinical counseling, then we need to take into consideration the amount of vitamins present in each of these foods. Generally, we take into consideration the quantity of calories present in individual food, but in addition to calories, we also need to need to carefully consider the amount of natural vitamin ingredient that they possess. Because if you consider the daily requirement of vitamins for an average individual depending on the gender, we need to look into which kind of food combinations would naturally provide the kind of combination that is actually needed to have or to give a balanced diet. So if you go further, here we have other more variety of food substances, and this has been taken by from a water soluble vitamin A assays nutrition material, which has done a survey of different kinds of ingredients. Now the question would be, now we are looking at the table of all the natural food substances which are enriched with this group of vitamins, what we are looking at. Now the question what we are asking, there are two kinds of questions we can ask. The first question would be, how did you estimate the amount of these set of vitamins present in them? Okay, if you are going to make this vitamin available for an individual, and let us say the individual is consuming these vitamins, how we are going to evaluate or how we are going to estimate the amount of substances that each of these food material is going to offer for the particular diet. And when a person is consuming this particular diet, do we have any means to really ensure whether the vitamin is really made available to the individual? In other words, what we are trying to look at over here, we are trying to ask this question: if a person is having deficiency, instead of only looking at the clinical symptoms, do we have any analytical methods? Yes, any analytical methods to check any of these vitamins mentioned over here individually, their quantity in every person that we are attempting to evaluate. So two questions. The first question is, in a food substance you want to measure how much of these vitamins are present. So the list of food substances over here, and this table gives a ready-made value of the vitamins which have been evaluated. Now the question is, how did they arrive at this particular concentration in each of the food substances? The second question I am repeating, it's about when you talk about a deficiency of a particular vitamin, or when you want to find out the requirement of a particular vitamin, how we come to know in the first place whether this particular person has this particular vitamin in an higher quantity or lower quantity in their physiologic response. Now the analytical methods have been done more or less over a period of time, and there have been different scientific ways of determining the amount of substances. So the contribution by Howard Sabolish has been tremendous. So Howard Sabolish is considered one of the pioneers in developing some of the methods in evaluating vitamins. So most of his work have been connected with the clinical evaluation of vitamins, how much quantification of vitamin is required, and how much method you could really use to be sure that you have a reliable source of vitamins which have been supplemented in the food that they take. So it will be better if you have to look into a little historic aspects of what all contributions that he has done. So Howard has independently come up with this microbiological assay of evaluating vitamins. So what is this microbiological assay? So there are different ways of looking at it. So if you look at this assay, what was his contribution? That was actually his PhD work, and he continued working on this particular topic for a wide variety of areas. In fact, eventually he became the chief of the nutrition technology Army Institute, and he later became one of the key contributors in developing nutritional related evaluation and whatever that is required in an army personnel and for the civilian source. So he was over there contributing for a wide variety of causes. So what was his contribution? So he had actually shortlisted how you can evaluate the vitamin requirement of an individual. So that's what is there in your syllabus. So it says that how much amount of vitamin available to an individual and how we really know different methods of evaluating them. So here in the first method, what we call it like the microbiological method, what they do over here, so they grow microorganisms. See, for example, there are a variety of microorganisms available in the nature. So when you say microorganisms, there are free living microorganisms, there are pathogenic microorganisms, you could have both. Now in microbiological assays, what we are going to do, every microorganism for that matter would actually grow in an environment. So when you say growing in an environment, they need nutrients for their normal growth. So what they do, especially Howard did, he will deplete every nutrient, especially in our case when our investigation is going to be on vitamins, he will deplete those vitamins. So when you deplete those vitamins, the rate of growth of microorganism would also diminish. Eventually the microorganisms would fail to grow. So through this method, he was able to evaluate the concentration of vitamin required for a particular physiological response. So one of the key contributions what he did is the discovery of Citrovorum factor. In fact, he used a microorganism called Leuconostoc citrovorum. So it's an organism which would grow, and what he did was he was able to systematically use a nutrient supplement, what you call it a Citrovorum factor. Later people were able to determine what was the Citrovorum factor. So it happened to be a derivative of folic acid, what we call it like folinic acid, and folinic acid is extremely essential, which is given as a supplement in certain cancer chemotherapy, especially when they are under folate inhibitors. Since you know, in the beginning of the previous session I was talking about folic acid, and we are going to deal about folic acid elaborately in the coming sessions, but I would like to mention now folic acid is an essential vitamin. So you see here, this folic acid is available in variety of derivatives. Folinic acid, as you see over here, is one of the derivatives. See, folic acid, we cannot synthesize folic acid, so we are dependent on dietary source, and especially the microorganisms living in our gastrointestinal tract, they produce folic acid for us. So what happens when you have to stop or starve a cancer cell, make it starve for folic acid, because folic acid is essential for making purine and pyrimidine and for DNA synthesis. So when you could like starve them, you don't provide folic acid in the diet, or rather you give a folic acid synthetase inhibitor, a folic acid producing or converting enzyme inhibitor, the normal cells would also get affected. So to avoid that, we use a hacking system, which is basically the use of folinic acid. So Howard's contribution was key. So independently he found folinic acid can be used as a supplement which is having properties similar to folic acid and would circumvent the pathway of tetraiofolate reductase mechanism, in which the folic acid could be activated, and folinic acid, if supplemented, could directly do the job of folic acid. So this was a breakthrough in cancer chemotherapy. Even now we use folinic acid as a supplement for wide variety of anemia, and it's become a mandatory practice to include folinic acid in methotrexate based regimens, and also for cancer therapies where we are going to target the folic acid or a metabolic pathway. Now microbiological methods are popular and it's relatively cheap, but if you consider it's little laborious because you have to grow microorganisms, make sure these microorganisms are not contaminated, and that's the limitation. But modern days we have come very far away. We use more modern equipments, as I have been mentioned it as a third point, and in this method you find more advanced techniques which are being used, but doesn't mean that the microbiological methods have gone obsolete. So even now for an evaluation, microbiological methods are as reliable as the modern analytical methods. Only difference is that the microbiological methods are little laborious or time consuming, but eventually if you are going to like really attempt a preliminary study, microbiological method of investigating to identify the amount of vitamins required for a particular group of cells or metabolic process are more convenient. So look at this. So the laboratory procedures used for assessing nutritional status. So, what do you mean by that? How do we assess the nutritional status? Because until you really assess the nutritional status of an individual, you won't be able to really know whether they have any deficiency of vitamins or what vitamins needs to be given as a supplement to really enhance their health. Now, in this case, we use 3 methods. I think in the previous slide I mentioned about biochemical method. So, picking up on that, so what do you mean by a biochemical method? So, biochemical method means if you could use simple chemical principles in evaluating bioanalytes, body fluids, to look for or quantify the substances present in them, and through that you would be able to ascertain whether a person is having disease or not. To be very simple, let us say a person is having I would say symptoms of jaundice, and the person visits a physician and the physician orders for a liver function test. So, this test is a biochemical test. So, what we do over here in a liver function test, we try to measure the bilirubin level in the blood and urine, and if the bilirubin level is going to be more than the expected value, then it means that the person is having symptoms like jaundice or symptoms of hepatotoxicity. So, similarly, what we are going to do in this case, in a biochemical method, we are going to evaluate the biological fluids and look for any physiological change happening which could be directly attributed to a vitamin deficiency. That is what we mean by nutritional status. So, when we want to look into the profile of an individual, so where do they lack or what kind of problem they have, what would be the vitamin deficiency that they suffer from, we need to assess. So, we do this by 3 different methods, and these 3 different methods have been closely associated with vitamin research, because vitamin requirement by individual can actually be revealed by these 3 methods. So, biochemical methods, as I have told you, is more reliable because they actually take body fluids. You can take the body fluids and assess them and look for the amount of vitamin that it's already there. Suppose if the acceptable level of vitamin is not there, then that's a clear indication that the person is suffering from a deficiency disease. Then what is this immunocompetence test? So, when you say immunocompetence test, so we have a list of 4 kinds of immunocompetent tests. For example, immune system which is actually affected by nutritional status is what we mean by immunocompetence. So, competence is efficiency. Immune system requires all these essential vitamins to function properly. So, if there is a deficiency of vitamins, the immune response would directly be affected. In fact, Howard's latest contributions before his death was to closely study nutritional requirements in HIV patients. Okay, so, what he did was he carefully planned a strategy of B complex vitamins and evaluate the need of these micronutrients and how they directly had an impact on the health status of patients. So, we are going to wind up this session, and we are going to, I am going to give a quick summary of what we have done so far. So, it says that we have already gone through the biological phases, and now we are moving into the phase of evaluating vitamins and their requirements that could be useful in improving the health status of individuals. So, we would continue the session in the coming series of lectures. Thank you.